Commissioners Board work session. It is Wednesday, September 28th, 2022. It is 9:32 a.m. This is set to go until 10:15 a.m. This is a hybrid meeting. We're in Building 1, Room 280. For public virtual attendance, you may follow along on the Thurston County YouTube channel. I'm Carolina Mejia. I'm the chair of the board. In the boardroom to my right is Vice Chair Ty Menser. To my left is Commissioner Gary Edwards. We have County Manager Ramiro Chavez as well as Assistant County Manager Robin Campbell. And we have a staff member joining us. We'll introduce here shortly. The topic on today's agenda is county options for 2023 health insurance contributions. So, what am I handing out?
We're getting the sharing screen down.
Oh.
Perfect. Sorry.
No, you're fine.
Still getting used to this new world of how we have to do things.
So let's go ahead and do introductions and then we can get started.
Okay. Well, thank you for seeing us this morning. Tara Wickline, Compensation and Benefits Manager. And I have with me Lisa Kaywood. She's our Senior HR Analyst in Compensation and Benefits. And our fun topic this morning is benefits and our contributions that the county pays towards employee insurance for next year, so for 2023. I put together just kind of an overview of how HR determines their recommendation for benefits and how the county actually pays for its employee benefits. So what happens is every year we receive rates from the PEB, from the Public Employees Benefit Board, on what the medical insurance premiums are going to be for the next year. We then take those rates, we compare them to the current year's rates, see what kind of an increase or sometimes decrease that we're looking at. We try to determine what impact to employees this is going to have, what impact to the actual budget. This year, we also were trying to take a look at employee recruitment and retention because we know that's an issue, I think, nationwide. And at the end of the day, we come before the board and make our recommendation to you. It is ultimately, your decision on how we handle and go forward with determining what the highest standard plan is. So for employee coverage is paid in full up to the amount of what we call the highest standard plan. So you commissioners decide the max amount that you want to pay for employees coverage. That's considered the highest standard plan. So all least expensive or less expensive plans, the employees still don't pay anything. Anything that's a little more expensive, the employees have to essentially buy up and pay the difference. Now for dependent coverage, it's a little different. Premiums for dependent coverage is more on a cost share basis. The county pays 85% of dependent premiums, the employee pays 15%, but that also is only up to the amount due on the highest standard plan. So if an employee chooses a more expensive plan, they're paying that 15% as well as whatever the difference is to buy up to that more expensive plan. Does that make sense? And then have any questions?
And it's the total difference is what they pay. They don't pay just 15% on the additional. They pay the total difference.
Right, correct, yeah.
So we're capped at 85% of the highest standard plan
For dependent coverage, yeah.
for the dependent, I'm sorry, and then for the employee?
For employees, we pay 100% up to the highest standard plan amount. So employees, at least for employee-only coverage, they always have a few options that won't cost them anything for just themselves.
The table on the last page of this packet helps that to make sense.
So for this next year, there was quite a bit of an increase in our rates. They ranged from about 3% to 11%. The current highest standard plan for 2022 was the 11% increase. We are currently budgeted for a 5% increase for next year. So our recommendation is to actually maintain the status quo. UMP Plus plan is our current highest standard plan. However, if we keep that as our highest standard plan, it is going to cost additional out of the budget. It will cost the county an additional $740,000. $341,000 of that is from general fund. The rest is from all other funds. And I'll go into a little more detail on why we chose this plan here in a bit. The second option that we're putting before the board is basically the plan, the less expensive plan that's kind of next to the plus plan. With that one, the county actually saves money because that plan had a much lower increase in premiums. It was under 5% that we had budgeted for. So if we go with option 2, the county will actually save about $23,000 overall, $5,000 of that from general fund. So why we chose these two plans? Option 1, the current UMP Plus plan, that's recommended because we're trying to keep employees as whole as possible. We're trying to avoid high increases in their deductions, and which also in turn helps with that retention. UMP Select, which is option 2, that was chosen as the next best option because the premiums are the closest to the Plus plan without going over and without requiring additional county funds. The only other option that was anywhere near these two, there is one plan whose premiums are in between the Plus plan and the Select plan. That option, Kaiser Value, the amount for that plan, the premium is only $2 different than the Plus plan. So the effect on the budget between the two plans is very, very minimal. And the next slide, I thought it would be beneficial to have the information about what plans employees are covered on in the county. You can see the enrollment by medical plan chart here that almost 60% of our employees are covered under Uniform Classic. The next most popular plan, which is Kaiser Classic, has an enrollment of 12% across the county. So 69% of our employees are covered on one of these two plans. So in the next slide, next couple slides, you'll see I'm focusing on those two plans to illustrate how this decision will affect employees in the future. And I only focused on those two plans because almost 70% of employees are enrolled in one of them. I also thought it was interesting that 50% of our employee population has employee-only coverage. And the other 50% is covering some form of dependent, whether it be spouse, child, or both. So on the next slide, these two illustrations here show what the difference in premiums will be for employees. This isn't total what they pay, this is just the difference between what they're paying this year and what they will pay next year. So if we stick with status quo and go with option 1 with the Plus plan, you'll see Kaiser Classic, anyone covered on that plan will actually pay less. Major reason for that is that we have budgeted that 5% increase already. The Kaiser Classic only had a 2% increase this year. If we stick with Uniform Plus plan, those on Uniform Classic, which is almost 60% of our population, employee-only coverage, they'll pay about $6 more than they do today. Family coverage, they'll pay just under $40 more. If we go with option 2, that's where the major changes start to happen. So Kaiser Classic, we're still gonna pay less because that increase was so small. On Uniform Classic, employees will end up paying almost $45 more, and these are per month, than they do today. A full family is looking at $130 more per month than they do today. And at the bottom there, I just kind of try to give you some numbers so you can see by coverage tier who's covered on what. 240 employees have employee-only coverage on Uniform Classic, so that's how many employees would either be paying an extra $6 or $45.
I'm confused by like, at the beginning, when you said the plus keeps the status quo close it keeps them close, but we pay
Right.
way more.
That's,
Why is there a disparity there if it's based on this algorithm or whatever structure of 85-15% for increases?
well, that's only for the dependent coverage, so we definitely share that,
But we're paying 100% of the employee.
of the employee. That's where the major cost when there's a huge increase like this comes from. Because the employees definitely are sharing in the increases for dependent coverage. Although on these two plans, the Kaiser Classic and Uniform Classic that I've kind of narrowed in on, those have never been standard plans. So all employees are paying up for that coverage to begin with.
Tara, do you know approximately the total payment that the county makes to the PEB,
Each month,
roughly?
we're at 1.7 mil, I think.
1.7 million a month that we pay to the PEB. And that payment is it's a combination of what the county kicks in and what is withheld from employee payroll. Makes up the 1.7 million that we pay to the PEB, and that total payment's gonna go up by roughly 10%, 10 to 12%. And so we have to either, the county needs to kick in more, or we need to withhold more from the employee every month. And these are the two options you have to get there. That total 1.7 million a month is now gonna be closer to 1.9. Right.
And on this table, if I may. The option one, the UPM Plus plan, you stated the recommendation is because we want to keep employees whole, where an employee will be 100% covered. But in this, I'm a little confused because the employee only on the first chart has an increase of $6.86.
That's because the Uniform Classic plan, they'll pay $6 more, but that's because that's not one of the standard plans. So the UMP Plus plan is less expensive than the UMP Classic, so they have to buy up for that to begin with. This year, I believe employees pay $15 on the Classic plan to have employee-only coverage. So next year, they would pay basically $21 to have that plan if we go with option one.
So the option one that you have in here is different than the option one in this table?
No, well, so option one is having the Plus plan be our highest standard plan. And
I got that.
yeah, and this table is illustrating how that will affect the majority of our employees.
Okay.
And because the majority of our employees are covered on either Kaiser Classic or Uniform Classic, that's why I chose those two to show how, what that effect would have on most employees. And I do have the information on how every plan will be affected, if you're interested.
These numbers are the delta. You just said they're already paying 15, they pay 686 more.
Right.
So this is not what they pay, this is how much more they pay.
More, right.
Go ahead, Commissioner.
And this is based, the total is based on how many employees we have currently? Is this based on FTEs that we have?
The total
Total
enrollment.
employees in the county?
Is what based on that, Commissioner? Is what based on that? You're
Is
asking,
the total cost that we're gonna talk about today based on the number of employees that we have?
it is, because it's the benefit that the county provides for our
Right.
employees.
So, I mean, if we had 10% less employees, it'd be,
We'd pay a little
10%
less
less.
in, yeah,
Yeah.
we'd be paying less in everything. It's no
All the way-
salaries,
all the
no
way through,
benefits, all of it.
so every time we add an FTE, it goes up.
Yes, and we calculate that when we propose additional positions to the board. We tell you how much a fully loaded position is going to cost, salaries and benefits, including the,
What's that number today? 'Cause,
on average,
yeah, how many employees do we have today?
1,200?
Yeah, roughly
So
1,200.
about 12,
regular.
we're kind of basing it, okay.
I thought you were asking whether there's economy of scale, meaning if we have 3,000 employees, our contributions will be less?
No, I wouldn't, no,
Okay.
no, I got it covered, thank you.
Okay. The last page was something that I threw in just because I find it interesting. I thought you might also. This kind of goes more towards that retention and recruitment, since the state is one of our biggest employee competitors. This shows for those two most popular plans, what employees pay at the county and what employees will pay at the state next year. You'll see no matter which option we go with, for most options, the county pays more for employee benefits, which is definitely, I think, something that helps to attract and retain employees from the state.
It was one of the things that I noticed when I came to the county from the state is the amount that I paid my share for medical. The same exact medical plan I had when working for the state, I chipped in less. So part of our pitch when we're trying to recruit is we got better benefits here in the county.
Yeah,
And
the
then-
select plan for a full family, it's more in
Yeah,
the
it's
county
more.
if we were to go with that. So I'm seeing here that the staff recommendation is that we go with the Uniform Medical Plus Plan Plus. So commissioners, do
Okay,
you have any questions, discussion?
I guess I want to make sure, because retention and recruitment is, to me, the biggest thing we face. It's every time we have to hire a new person, train a new person, do the whole thing, it's a total expanded cost. So whatever we can do to retain people and consequently recruit people when we need them, but we won't need to recruit so much if we can retain more. So the staff is recommending that under option 1 would accomplish that mission better.
It would certainly help, I believe, yes.
Okay.
Much so than the alternative.
And it's gonna cost us more, but in the long run, how does that all equalize out? You know, if we have to recruit 100 more people because we don't have.
Then
So-
it's gonna cost the
Right.
county more,
Yeah,
right,
so
than it would if.
that's
we
kind
were-
of, I don't like the idea of $740,000, but I don't know that it isn't cost effective in the long run to do it.
The general fund will cover.
Pour it up about half or whatever.
342,000 is a general fund expense
And
that we're
I
estimating.
believe that is part of the initial discussions that Robert presented to you on the model. That includes some of that decision-making process.
That's right. We assumed option 1 in the model that you have already seen. But really your choice is, the county is going to pay an additional $740,000 to the PEB for these benefits. And the question before you is, does the county pay that increased cost or do the employees chip in and pay that increased cost, chip in more to pay that increased cost? Does the county bear it or does the employee bear it? And when we're talking about COLAs, the big conversation that was always had at the state was the state often chose for the employee to pitch in more. And the more that the employee pitched in was more than the COLA that they got. So really an employee was losing money when these things.
Yeah, and then you
Yeah.
figure inflation in on that one this time around.
Exactly.
It's gonna be twice as much.
So this is why this is our option that the staff are recommending. Let's go with the option. It is a little more expense to the county, but it plays to employee retention.
Provided, I mean, flip side of what you said though is sometimes people aren't all that logical about, like, as long as it's really front and center in our negotiation that, hey, we're holding the line, maybe, like theoretically, we're holding the
Right.
line on a 3% COLA because we went to bat on the health benefit. Like, we have to be credited
Step
for
back.
Like people have to be able to
Yeah.
understand that they're getting.
Sometimes
They don't,
union
they'd rather
laws-
just get the COLA.
Absolutely on point,
yes.
because that is not forgotten. For
Yeah,
sure.
I mean-
And then that's an excellent point.
So I just
The
want to.
unions never recognize.
Right, they don't, I don't feel like we ever get any credit for making these choices that I've made time and time again on my 4 years on the board. We've always gone for the more generous option on health benefits that were presented by the staff.
I wouldn't go that far. I mean, like, I think that's what really honestly helped us with negotiations with sheriffs and the sheriff's office this time around. And not, you know, not going all the way to mediation was just the fact that there is a great benefit with health insurance.
The sheriff has a slightly different deal under their contract. Their health benefits for themselves and their dependents are fully paid,
It's
no
Cadillac.
matter which
Yeah, it's Cadillac.
they choose. It is
It's
the
a Cadillac.
Cadillac
Yeah.
version.
But
Rest
still,
of
like
us have
that,
Chevrolet.
but
I've had a half a dozen meetings with groups of employees that were unhappy, and not one time did it ever say, thank you for, you know, we want it, like, did that into the discussion as a key point. Again, I think it is a key point for them, and we should continue to do the way we do it, because I think we're doing the right thing, but just pointing out that it's not always gonna.
Yeah, and hopefully employees are listening to this conversation.
It's not always.
I guess it's human nature, I think.
Right.
I've been involved in this kind of stuff for many, many, many years. And I will say, it's kind of, what have you done for me today? I kind of forget right away, what did you do yesterday? You know, but it's just reality.
see, I guess I have a different completely viewpoint. I don't think we should be thankful for this. I think this is what we're supposed to do, is provide that work-life balance and provide that healthy balance outside of work. So I don't expect for, you know, I feel this is definitely an attracting factor, and so I think, you know, I'm definitely in support of the staff recommendation, because I think it just kind of helps support that work-life balance that we talk so much about, and we try to promote. So, you know, I just have a different viewpoint and you know, when it comes to that, and then COLAs and.
Well, I guess
Well, I'm with you. I'm with you on that. And, but the reality is, from a business plan, it also makes sense because it costs to recruit, train, bring folks in.
And I guess perhaps the conversation is, the board in this particular case has options. And you're choosing, if I may, you're choosing to go with a higher benefit to the employees. That is, I guess that is the point, because the board does have an option. You have two options, right? As Robin explained, health insurance are going up, you have the option to keep up and maintain the base plan or not. And perhaps you're taking the option of continue to support the employees, and that is an option.
There is an option that we didn't put forward, and we have options in which plans we offer our employees. I mean, we could not offer one of the more expensive plans, but there's really no reason
They're paying
to
for that.
do that when, exactly, when
It's
the
not
employee
cost
pays extra.
My only point is just that if the discussion is only about retention, and for me it's not, it's about many things, but if it were only about retention, I'm not convinced that this is the best retention strategy versus a higher COLA or a higher pay. But that's all I'm saying, you know, but I do think for a lot of employees, they will look at these numbers and they will see the benefit, and they will hopefully see that the county's way ahead of the state on the generosity of our benefits. So I'm hopeful, but just when I go meet with groups, I don't hear that.
They're usually upset about something.
Well, I mean, even just about,
many things, many things.
but just, it's about, you know, it's more just about salary.
Yeah.
But anyway,
But, you know, this is one thing I always bring up at every meet and greet, is that you've chosen the best place to live and work here in Thurston County. I believe that. I think this is a piece of it.
So where I'm hearing the board perhaps is agreeing on option one.
So that's how HR will now build the open enrollment offering for November, and what you'll see in the budget as we review it.
Starting on Monday.
Yep, start Monday.
And I'll put together a resolution before open enrollment to make it official before we
Thank
do
you.
release rates. Thank you all, appreciate it, thank you for your time.
Good job.
Yeah, thank you for putting all this, this very complicated stuff, for putting it together and making it less complicated. I won't say
I try.
have a complete understanding when you're done, but it's less complicated.